Once prostate cancer is diagnosed, the next question every man asks is, Doctor, how serious is it? The answer lies in risk stratification, a scientific way to understand how aggressive the cancer is and what kind of treatment you really need. In this episode, I'll explain the Gleason score, NCCN risk groups, the AJCC 8th edition staging, and how life expectancy helps doctors personalize treatment. So, let's start with something every biopsy reveals, the Gleason score. If prostate tumors contained only one pattern of cancer cells, estimating risk would be much easier. But prostate biopsies often contain more than one pattern of cells. To account for this, the two most common Gleason patterns found in the biopsy sample are combined into a single Gleason score. The pattern of cancer cells that takes up the largest area in the sample is assigned the first number. The pattern that accounts for the second largest area is given the second number. Add these two numbers together and you get a Gleason score. For example, pattern 3 plus pattern 4 equal to Gleason score of 7. Gleason patterns. After studying your biopsy sample under a microscope, the pathologist will assign a number based on the pattern of cancer cells, Gleason pattern, in the sample. A pattern that looks more like normal and healthy cells is given a lower number. A pattern that looks more abnormal is assigned a higher number. Gleason patterns range from 1 to 5. However, patterns 1 and 2 are not considered cancer and are no longer used. So the lowest is pattern 3, which looks the closest to normal cells. A Gleason score represents how much your biopsy sample looks like normal prostate tissue. It also estimates how aggressive your prostate cancer is, how quickly it might grow, and whether it will spread. A higher Gleason score means the cancer is more likely to grow and spread quickly than a cancer with a lower Gleason score. Gleason scores range from 6 to 10, where 6 is the lowest score. A Gleason score of 7 is intermediate grade and 8 to 10 is high grade. This can be confusing because 6 seems like it would be a medium score, not a low score. So to make Gleason scores simpler to use, they can be organized into grade groups. Grade groups. A grade group is a way to interpret a Gleason score. There are 5 grade groups numbered 1 to 5. The higher the grade group, the more aggressive the cancer. So, cancer with a Gleason score of 6, the lowest score, is equal to grade group 1. Likewise, cancer with a Gleason score of 9 or 10 becomes grade group 5, the highest score. Importantly, this system also takes into account that grade groups 2 and 3 each have a Gleason score of 7. The difference is that the cancer in grade group 3 is more serious. Why? Because the first number of the Gleason score in grade group 3, 4 plus 3, is higher than the first number in grade group 2, 3 plus 4. Remember, the first number is given to the cancer pattern that makes up the largest area of the biopsy sample. Grade group 1 indicates low risk. Grade groups 2 and 3 correspond to intermediate risk. Grade groups 4 and 5 predict high risk and very high risk. What's your risk group? Based on the results of these tests and calculations, PSA level, grade group, tumor, stage, and biopsy results, you will be placed into an initial risk group. Your risk group helps determine which treatment options may be best for you. Using these tests together to create risk groups is more reliable than using any test by itself to choose treatment options. But risk groups aren't the only risk assessment tool. There's also life expectancy, nomograms, and specialized risk tests. Life expectancy is the average lifespan of a person. It's measured in years. An estimate of your life expectancy is a key factor in deciding which tests and treatments you'll need. It's important to know that life expectancy, when used for cancer care, is an estimate based on large numbers of people. That means life expectancy can be applied to a certain population or age range, but it's not as easy to make a precise estimate of the lifespan of an individual person. So why estimate your life expectancy? Sometimes patients in certain risk groups should wait until symptoms appear before having tests or starting treatment. There may be no benefit to having additional tests or life-threatening treatments if you don't have any symptoms or if you have other more life-threatening health conditions. If you don't have any symptoms and have very low risk or intermediate risk prostate cancer and a life expectancy of 5 to 10 years, then observation is usually recommended. This is different from active surveillance, which usually involves routine imaging and biopsies. Specialized risk tests. Your doctor or healthcare provider can order tests. One of these tests is called Decipher Prostate. It looks at the molecular characteristics and gene expression, which genes are turned on tumor in a sample of your tumor. Another test is called Artera AI Prostate. It looks at a digital image of your cancer biopsy and uses artificial intelligence to predict in potential treatment. The AJCC 8th edition defines exactly where the cancer is and how far it's gone. T. Tumor. How big? Is it inside or starting to push out? N. Nodes. Has it reached lymph nodes? M. Metastasis. Has it traveled? Doctors group these into stages 1 to 4 for a quick summary, from earliest to most advanced. This, your risk group, and Gleason score are like a GPS for planning your care. Now you know how risk and stage drive what happens next. But what exactly does a low risk or high risk label mean for your treatment? Thank you for watching. In the next episode, we'll break down treatment choices for each risk category. Is surgery best? Can you just watch? Does radiation fit your risk? The answers are personalized and powerful.